The Hitwad, Sunday, September 28, 2014. Negative emotions, depression, may lead to heart ailment. Dr. Vikas Bisne. Behavioral problems have connection with heart disease. Smoking, lack of exercise, alcohol, diabetes are the routine things which can be said as risk factors for heart. But various psychological factors such as depression and chronic stress has been linked to development of coronary heart disease, said Dr. Vikas Bisne, noted interventional cardiologist. In 2005, on the basis of review of such associations, emergence of new field of cardiology was predicted. Over the last decade, studies of psychosocial risk factors for coronary heart disease have been found to be on rise, said Dr. Bisne. The need for a patient to consult a cardiologist can be exemplified by the case of a 65-year-old man who recently suffered an anterior wall myocardial infarction and who has been participating in cardiac rehabilitation, who presents with feelings of overwhelming depression and hopelessness. On 3 occasions since his hospitalization, he has been evaluated in the local emergency department for recurrent chest symptoms. Each time his evaluations have been suggestive of non-cardiac causes of his symptoms, and he has been advised to continue with recommended medications with follow-up through his primary care provider. After these processes, it is time for the cardiologist to identify and treat the cause of his current distress. While this case is somewhat extreme and unusual, it is not uncommon. It typifies an unusual dilemma in current cardiovascular healthcare: coronary artery disease. Risk is associated with certain psychological factors such as depression, yet treatments that effectively treat both psychosocial and CAD outcomes have been somewhat elusive. Results of recent clinical research have strengthened the understanding and management of the links between psychosocial and CV health and have moved in the field of behavioral cardiology steadily closer into the mainstream of current clinical cardiology. Dr. Bisne pointed routine risk factors: smoking, alcohol, hypertension, high cholesterol, diabetes, but behavioral risk factors which are subtly present in everybody. There are 5 major categories. 1. Physical health behavior. It includes physical inactivity, poor diet and obesity, smoking, poor or inadequate sleep, inadequate rest and relaxation. 2. Negative emotions and mental mindset. Depressive symptoms, anxiety, pessimism, anger and hostility. 3. Chronic stress, that is work stress, martial stress, social stress, caregiver stress, childhood and adult abuse, medical illnesses, also responsible for heart ailments. 4. Social isolation and poor social support. 5. Lack of sense of purpose. Physical fitness reduces heart rate, blood pressure, cortisol responses to psychological stress. Physical fitness also removes depression and inflammation. It also decreases the likelihood of diabetes, which can lead to heart disease. Total 50% of survivors of myocardial infarction having evidence of significant anxiety and or depressive disorders, the presence of adverse psychological factors can significantly worsen coronary artery disease risk and prognosis. And psychological health status is generally responsive to behavioral and pharmacological therapies. Behavioral cardiology is a complex field. As with many areas within behavioral medicine, and is one that hinges largely on the ability of non behavioralists, generally cardiologists, to identify affected patients and to initiate the early steps in their psychological care, added Dr. Bisne. The author of this useful article is Dr. Vikas Bisne, MBBS, MD Medicine, DNB Medicine, DM Cardio, DNB Cardio, FACC, FSCAI USA, FCSI. Dr. Vikas Bisne is a cardiologist and director, Bisne Heart Hospital, Nagpur. He is also attached to Mediterranean Institute of Medical Sciences, Nagpur, as an interventional cardiologist. His areas of special interest are interventional cardiology, pediatric interventions, pediatric echocolor Doppler, and clinical cardiology. Dr. Vikas Bisne is credited with performing the first balloon angioplasty for coarctation of aorta in 1994. He is also one of the first cardiologists in India to have done non-surgical PDA closure, ASD closure and VSD closure by device, coarctation dilation, intravascular ultrasound and rotablation. Apart from his clinical practice, Dr. Bisne also serves as Honorary Assistant Professor of Cardiology at Medical PGI and Super Speciality Hospital, Nagpur. Earlier, while he was studying for his MD, DM and DNB degrees, Dr. Bisne lectured in medicine from 1985 to 88 and cardiology from 1991 to 92 at Grant Medical College and Sir J. J. Hospital, Mumbai. This article has been read on this YouTube video by Mr. Milind Rahatgaonkar.